All right, welcome to Thrive, the Feline Wellness Summit. My name is Scott Colby, and I am here with a special guest, Michael Daly. Michael, how are you?
I'm good. I'm good. Glad to be here.
Yeah, glad you are here. I'm excited. We're going to be talking all about the senior felines, which I am pumped up about. Let me give people a brief introduction for you in case they don't know who you are. So, Michael's actually been working in the animal field as a vet tech, a canine massage therapist, and a holistic pet health coach for over 20 years. He has clients all over the world and at home in Charleston, South Carolina. So, Michael, I'm really pumped to have you. And as soon as we hit record, one of my cats walked right behind my computer. So I might have some felines making an appearance. Um, but
Oh,
again, yeah, I know we're going to be talking about senior felines, which I love because I've had cats in the past that have passed away, but they made it to the ripe old ages of 16 and 20. So this interview is highly relevant for that situation and for a lot of our viewers who I know have senior felines. But as you probably know, Michael, senior felines are so special and unique. What's the first thing you might tell somebody when they ask you how to keep their senior cat healthy and happy?
oh gosh. Well, number one is letting them know that they rule the house.
Absolutely.
I mean, but health wise, wet diet is always, I know that's nutrition's a big thing discussed, but just water, 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 wet, wet, wet is the number one thing I would say if they're going to do anything.
Yeah, that's awesome. And I would add in there, even if they're not seniors, cats still rule the house, right? They're the boss, whether they're newborns or 20 years old. But yeah, and I know we're going to dive into different health issues like kidney disease, and we'll dive into nutrition. And I also want to share a little bit about my two cats that, like I mentioned, were seniors because one of them did have some of these things we're going to be talking about, kidney disease and mobility issues. So let's maybe dive right into kidney disease.
Sure.
I know it's so common in older cats. Can you explain maybe a little bit about why it happens and share some natural or holistic approaches to managing it?
Sure. Yeah. So I have a senior cat as well. So which is he has been really my big teacher on a lot of this stuff because I've been able to, I've had him. He's 17 now,
Hmm.
and I've had him. I met him at a vet clinic, and I never. It's interesting. I never took cats home when I worked at vet clinics, and for some reason, this cat, like, I opened the cage he was in, and I was like, "You're my cat."
Oh, nice. Yeah, it happens that way, right?
Yeah, yeah, and so and that was 17 years ago. So like I have been able to really sort of try different things for him, different supplements for him. So he's really been a big teacher of mine. And so with kidney disease, basically, it depends on really the age of the cat. So a lot of times, so if I have Nemo, which is my cat, comes in and I'm actually about to repeat blood work on him, and so and currently he's had no elevation in his kidney values whatsoever, which has been great, knock on wood. But if my vet comes by, we do some blood work and we see some elevation, there's a couple of things I need to think about. So the kidney's jobs is basically to process waste out of the body. And so if I start seeing any sort of elevation, and so they consider kidney disease into four different stages, 1 through 4.
Mhm.
And so when we start to see level 1, they start to say, okay, well, we're looking at kidney disease. Now, back in the day when I was first a technician, they called it kidney failure. This kidney failure was the big word. But now that we've kind of learned more and vets have learned more, it's turned into a kind of a nicer, kidney disease. And so if I have a 17-year-old cat that is looking at some elevated, and so the enzymes that we're looking at, the primary enzymes that we're looking at are the BUN and creatinine. And so if I'm starting to see some slight elevation in those, there's a couple of questions I need to ask myself, and one of them is age. So like usually if we have a pet that I feel like, and I tell this to clients a lot of times, is if you have a pet that is older and they pass away from either cancer that they get that age or kidney disease, and your cat has lived a pretty good life because it's one of those two that eventually may get us, as we're older.
Yeah, and I mentioned one of my cats actually had kidney disease. So she was actually 16 when she was diagnosed with it, and it
Hmm.
was stage 1. So we really just had to watch the values at that point, didn't really have to do anything. As her values started to change a little bit, we would go to the vet a little bit more often and get her blood work done. Eventually, we started giving her fluids,
Hmm.
and at that point, again, we just started to go maybe once every 3 months, so like 4 times a year, just
Hmm.
to make sure. But one of the things I was always worried about, and this was because my sister had a cat prior to me, about several years before I did, and her cat lived to 19, but it eventually got kidney disease as well.
Hmm.
And my sister started to give her cat fluids.
Hmm.
It was a battle, Michael. Like,
Yeah.
you have to kind of like trap the cat in the bathtub. And she said it was a traumatic experience. And
Yeah.
so me thinking that, I started to worry, like, oh my gosh, if my cat's ever got to that point, how am I going to do this?
Right.
Fortunately, one of the things I did, there's a great kind of a pet sitting service out there called Rover, but
Mhm.
a lot of times you'll find pet sitters that are also vet techs or vet students.
Oh yeah.
I found a vet student on Rover and hired her to come over 3 days a week to give Mia some fluid, so I didn't have to do like the needles,
Yeah.
which I actually love. So there are resources out there. When my Eventually she was told to be put on some sort of special kind of kidney diet food, renal food,
Right.
which Mia didn't like, and we never could get her to eat it. But what are your and I kind of feel like we have a couple different paths we can talk about in this
And I
conversation.
was like, should I stop here? I can keep going on
Yeah.
it.
I think we can talk about things treatment, but also preventative, right? So
Exactly.
maybe let's look at like treatment first. So if your cat has kidney disease, let's say,
Yeah.
I was just kind of working with my vet and getting a prescription for, like, Royal Canin or something like that. Where do you fall in terms of something like that versus doing maybe more of a holistic approach or making your own food, things like that?
So that's the thing. So there's a lot of questions there's a lot of questions that need to be answered first before we start to have a vet that says that the diagnosis for your pet is a certain stage of kidney disease.
Mhm.
So if I have a cat, and this pertains to old age as well. So if I have a cat that's at stage 1 kidney disease, meaning that the BUN and creatinine levels are slightly elevated, or just BUN is slightly elevated. And I always kind of talk about with other pet health coach students that, and it's sort of my layman's term of how I describe kidney disease, is that there's almost like different levels of the where it is. So like BUN is sort of like, if you're seeing that elevated, that means there's some initial inflammation is going on.
Mm.
So either the pet has just been given a heartworm preventive, or possibly dehydration is causing it. And then we get to level 2, which is the creatinine. And so that means that they're working a little harder. And so there's a couple of things that we need to ask ourselves before we start using any preventives or changing any diets, if they're at a level 1, and that is infection. Is there any infection going on? Because if there's an infection present, then that means the kidneys are going to be working overtime. So we want to rule out things like dental disease is a big thing for older cats. For dogs, I would say like ear infections, skin infections, kind of stuff like that. Urinary tract infections
Mm.
are a huge factor when it comes to kidney disease diagnoses and the certain levels of it. So that was what I would do first, ruling out all those things. And then to say, okay, now we're dealing with a kidney disease. Now, does this mean that we need to start changing our food? No, not necessarily. Unless you're feeding a dry food, then you'd want to change it to a wet food, because the goal of that is to keep the kidneys flushing. We want to help the kidneys flush out any sort of infection, present or waste present. And so flushing we start doing like you were doing with IV fluids. And so to go on to any sort of prescription diet, so the idea behind prescription diet is that there's less protein in the diet. Because when we have a pet that's at, say, like stage 4 kidney disease, they're not able to handle the phosphorus that's in protein. And so, as a pet health coach, and I was trained by Dr. Ruth Roberts, who used to own a clinic here at Sundog Cat Moon, we were trained to recommend that a pet does not go onto a prescription diet in general, because we believe more in home cooked food, but a low protein diet until they're at stage 4, until their kidneys can no longer handle the phosphorus. Because what tends to happen is that when you're lowering the amount of protein in the diet, you start seeing muscle wasting. And you will literally, if you can actually physically see a cat that is in kidney disease on a prescription diet. Their coat is really greasy and they just start to look emaciated. And it's not a matter of them losing fat, they're losing muscle mass. They got that skinny coat, just dry and gross. And that is from the low protein diets.
Yeah, and unfortunately, Mia, she had like almost like the trifecta. So when she was, so the day she was diagnosed with kidney disease, she was actually supposed to have a tooth pulled because she had an abscessed tooth and it was bothering her. Then she was diagnosed with kidney disease, and because of her age 16, they didn't want to put her under anesthesia. So we had to, unfortunately, just manage her tooth pain throughout her last 4 years of her life without ever getting it out. Then she had kidney disease. She had some mobility issues, which I know we're going to talk about as well. And like I mentioned to you before we started recording, as a first time pet/cat owner back in 2003, I was feeding her kibble, dry food
I
for
do the
the
same.
for the first 12 years of her life, not knowing any better. And it wasn't until she had a pancreatitis episode that I learned from the vet then, like, hey, start to get her on some wet food. That's going to be better for her. And that's when I got her and her brother Nomar on wet food. So I probably feel like for the first 12 years of their life, maybe they didn't get enough hydration, maybe enough water, which I know that's so important, which you mentioned. What are maybe some creative ways that cat parents can encourage their cats to drink more water? Is that even a thing?
Yes. Oh my God. Yes. Well, I mean, a wet diet is the best thing,
Yeah.
really, to get them drinking more water. But you can add things like honey can be added to water to make it kind of sweeter. Nemo. So I was the same as you, and I worked at a vet clinic. I worked at vet clinics, and I gave Nemo
I
dry
don't
food.
feel bad. You're more knowledgeable than me, and maybe you
Well,
didn't.
because we're told, oh, the crunchies of the food are going to help clean up the tartar,
Right. Yeah.
And I mean, and it's not anything against veterinarians. Like, I don't, I don't think they were like, oh my God, we're out to kill your cat.
Right.
I mean, I've worked with vets that have like been in tears trying to save a cat, and they're in the business because they love animals.
Right.
But that's what we were taught. Like, I was just, I was like, oh, the crunchies are helping with the teeth, and so you start to realize, how important hydration is. But Nemo is a big the running water, like any sort of running water fountains, like, because they want consistent, clean, cold water. So that really helped with Nemo. So, and then also like even adding like tuna juice to water, things like that. So yeah, you have to be kind of tricky with that. And I will literally, and I will swear by this. Cats are mind readers. Okay? Absolute mind readers. Now I was called, what did I was called? When I worked at Sundog Cat Moon, because I was known for, I loved getting the clients that had fractious cats. If I heard a cat screaming in a room, I'm like, I want that cat. So like, I can't remember what Dr. Roberts used to call me, like the cat man or something like that. And because because I would be like, let's do this cat.
Yeah.
And I really, and it's something I just thought to myself, and I was like, I wonder if they can read like my mind. And so whenever I would handle a cat that was fractious, I literally would go into the room, I'd clear my mind, I'd walk in, and and I'd be just very matter of fact about it. Just very matter, like, give me the cat, and literally the cat would be fine. Not, I mean, not all the time, but
Yeah.
a good majority of the time, it really helps. So I am a, I'm a firm believer that whenever you're making any changes, like you cannot make a big deal out of it with your cat.
Mhm.
They will just be like, "Why are you making a big deal out of it? Why do I have to do this? I'm not doing it. Why do I have to do it?" You know?
Yeah, and we had, Melissa Sherman on as a guest who talked all about kind of
Oh,
the energetics
yeah.
and communication. Yeah, she said if the pet parent is anxious and stressed, then the cat's gonna pick up on that, and they're gonna feel the same way. I was like, "That is such
Just
good
make you
information to
more
know."
anxious.
Yeah, right, yeah. That's amazing. Okay, so later on, I wanna circle back and talk more about nutrition
Mhm.
and preventative. I wanna switch over because another big challenge that Mia had, as her last 3 or 4 years was mobility.
Yeah.
So she definitely had arthritis, and then there was actually her, um, her when she had 6 when sh January of last year, so she passed away in June of 2023.
Mm.
In January of 2023, she actually had an episode where she could barely walk. She just like her hind legs almost like gave out and she started like scooting, like sliding. And
Mm.
so like I got really worried. Of course, I'm like, "Oh my gosh, like this isn't any way to live."
Mm.
So we actually put her in a dog, almost like a dog playpen to
Mhm.
keep her confined, put her litter box against the wall where she could only go slide into the litter box and out. But I thought, okay, this is it. If she doesn't get better in a few days, magically just by rest, and we actually did a couple treatments of acupuncture.
Good.
That the woman came to the home.
Mhm.
Her gait got better, but her mobility was pretty severely compromised towards the end.
Yeah.
Just I know mobility can be a challenge for our senior cat. So, what are maybe some practical tips or therapies that cat parents can try at home to help their senior cats stay active and maybe prevent this a little bit?
Yeah. So my cat, Nemo, because he used to be indoor outdoor
Okay.
when I first had him. And I don't know if I feel like he fell out of a tree because he used to climb trees a lot when he was younger. And that was at about 6 years old. And so, and he was limping when he came out. And so, ever since then, he's been struggling with that. And now that he's 17, it's his hips are really, really terrible. I've done X-rays on them, and they're just arthritis is all over. He's overcompensating to his front to alleviate the pain in the rear. So I've pain management has been a main learning lesson with him.
Mm,
So at home, stuff that I would recommend doing is so I do massage therapy for canines and I've done cats too.
I was going to ask you that actually.
Yeah, yeah. I've only done a couple because I can't. It's cats are hard because dogs are gonna be like 30 minutes and it's this much.
Right.
Cats, like I don't know. I can't tell you how this cat's gonna do. But I've worked on a cat that have worked on one cat that was who would do the whole 30 minutes. It was
Oh,
great.
wow.
Yeah. So but I do massage therapy for Nemo and it doesn't massage therapy doesn't necessarily have to be like, I have to know exactly what the insertion and origins are, the muscles. It's just really and how to do any sort of strokes. It's just kind of really knowing like, the back, the hips,
Mm,
And so with cats, they're primarily and with most animals because they're all sort of designed sort of in this fashion where they've got the rear legs to propel them forward, and so they're going to start to initially get any sort of inflammation or arthritis in one of the back rears, and then as they age it sort of kind of goes into the other one, and then they push forward to alleviate the pain, but then as that happens it pushes along the spine. So if you're able to just sort of gently, so like say like this is the back of the cat and I've got the spine along here, just like adding really light pressure along
mm,
that spine, and you can able like, and I'm barely touching, and that's really all the pressure you have to do for animals. to sort of release any sort of tension. And so I always kind of, and if you can sort of do it, you can almost feel along. So this would be the longissimus muscle. And then as it gets to the rear end, it turns into the lumborum. So it's kind of spreads. It almost feels like wrinkled paper.
Mm.
So if you can sort of like just lightly, like just de-wrinkle that paper, that's going to make a huge difference. It really, really does. So that will help with at-home mobility for your pet. There is, I usually for Nemo, I've kind of gone down the supplement world for that for him.
Okay. Yeah.
Um, I do cold laser therapy as well, and
Yeah.
so
We did that for Mia. Yeah.
yeah, and that can be helpful. Acupuncture, if your cats will do it, is amazing for cats. That is especially for when you were saying for Mia. That I was gonna. The first thing I thought was acupuncture.
Yeah.
Um,
She did well. We did 2 sessions. I'm not sure what if it worked because the first time we did it, she had already gotten her mobility back, and it was hard to tell, but she handled it well. I mean, I think, at that point she was 19 and 3/4, so probably just kind of tired, and just kind of took it. But I just I don't know. I loved, trying something like that that was kind of thinking outside the box a little bit.
Yeah, exactly. And I think the thing to think about too is that I always tell clients this. I always, if you have an older pet, you have to picture them like an old person.
Hmm.
Because because I work on a lot of seniors just overall. And like people will flip out when their pet is limping and they're like, I don't know what happened. I don't know what caused it. And
Yeah.
it's like, I always say, listen, like you have like a 90-year-old person living with you. I'm 48, and if I pick up my phone the wrong way, my back goes out. She could have just looked the wrong way.
Mm,
So
yeah.
just take a breath and just give it some time. And like you were perfect. Like you're putting them in a herd crate just to really rest, make
Mm,
sure she's not jumping. I mean, rest is really for any sort of injury is the number one thing that is the most important thing for a pet. Because I see
mm,
this left and right with injuries. I see, oh, I'm putting this supplement in, doing this, and then they'll have the dog run or cat do whatever, and nothing gets fixed because they're not allowing the muscle recovery time.
yeah. Yeah.
You
What type of supplements do you give your cat? In terms of like
What
maybe
more do I
yeah, maybe to help with like mobility.
know?
You don't have to list like if there's a whole sheet of it.
Oh no. And this was the journey of Nemo that I had to really go through because
Uh,
cats are so picky.
right.
They're so picky, and it actually took me time to get him onto homemade food, even because
Okay.
we have to switch him from one to another and then to another. And so the first thing that really made the difference for him the most, and that he was actually eating out of the bowl, was CBD.
Okay. Yeah.
So a friend of mine opened vet CBD with a veterinarian, and so she was like, "I know you do massage. Do you want to try some of this CBD?" And I was like, "Oh, sure, yeah, absolutely," because it was free. And I gave it to him, and he ate it, and I was just like, "Oh my god!" Like I had not seen him do that, and I felt so terrible because I'd known about CBD, but he was so picky. And so that was the first initial thing where I saw the most change in him. That I saw him like running around and like running upstairs
Hmm.
balls. And so that has been the biggest difference with him. And then most recently, because I have gone through the gamuts of different things to try. I did that. I've done also different the CBD kind of he stopped wanting to eat it, and so I've switched different brands. And I will say that I feel like the CBD hasn't been as effective as it had been before. But it makes them comfortable.
Hmm.
Um, it's always that tricky thing of like, is it working? And then you don't know it's working until you stop it, and you're like, oh
Right.
yeah, yeah. But I most recently just started using Arnica,
Okay.
which is more of a homeopathic um, pain relief supplement. And so there's one called Pet Relief that a coach had used for her dog, and I thought I would try it. And again, Nemo is eating it right out of the bowl,
Hmm.
and he's definitely has a lot more pep in his step.
Hmm. Yeah.
Um, yeah, so pretty much those are the two things.
Yeah. And then just I know some simple things that people probably have tried if their cats are getting a little bit older and less mobile. Of course, just getting some portable steps that you can put in your home, get up and down the bed or the sofa. I know that really came in handy for Mia her last couple of years.
Yeah.
And then I bought a warming bed for her. She had lost quite a bit of weight over the last couple of years and just lost that muscle.
Hmm.
And so just to keep her warm, she was sleeping so much
Yeah.
towards the end. And I thought that was just something that probably helped, maybe just keep her
Yeah.
joints a little bit less painful for her.
Absolutely. Yeah. And a lot of times you have to just kind of like change up the kitty litter boxes.
Yes. Oh, yeah, did that as well.
Yeah. You're reminding me of stuff too. I'm like, oh, yeah, the stairs.
Yeah.
Yeah. Stairs definitely he got used to uh the what was the other thing? Oh, PEMF mats are have you
Oh,
heard of
no,
those?
what's that?
So they're pulse electronic magnetic field therapy mats. And so it's sort of almost like a that's the right way to describe it, but sort of like a lesser degree of um, decreasing inflammation that cold laser does.
Okay.
So they actually have cat beds. And so your cat can lay in it for like 10 to 15 minutes and it's supposed to help. So I know I haven't tried it with Nemo yet, but I want to. But I know it's been really beneficial for a lot of dogs that I've worked with.
Mm,
So that's another unsupplemental modality that can be really useful.
nice.
Yeah.
Let's switch back to diet and think about diet as the foundation of wellness. So let's not think of a cat that already has illnesses like thyroid issues or kidney. Let's say there's a senior cat out there that is completely healthy, but knowing that diet is a foundation of wellness, what are the most important considerations for creating a diet plan for a healthy senior cat that could maybe prevent some of these diseases from cropping up, or at least cropping up early?
Yeah. So I think preventive wise, diet wise, it's really going towards keeping the gut healthy.
Okay.
So if we look at functional medicine in terms of inflammation, all inflammation comes from the gut, and inflammation ranges from anxiety to cancer. So that would be all the preventatives that we're looking for with older cats. So with that, we want to feed, and I'm not a like. There's the whole like fresh food, raw food debate. I'm not a debater on it. I think they're both amazing. I was
Mhm.
personally trained in did I say fresh food and raw food? I meant
Yes.
raw food and cooked food.
Raw
Yeah,
food culture.
yeah. So I was trained in cooked food just through having worked with Dr. Robertson and having seen it used in clinic. And it's
Mhm.
the traditional Chinese veterinarian aspect that I like to follow. So but with either one, it's about really feeding, real food, real nutrition, real protein. With cooked food recipes, you are also throwing in healthy leafy greens that help feed the gut. So it's about keeping that microbiome happy in the gut, as well as healthy fats to keep decreasing inflammation. So I think that diet is the main thing I always start with all my clients first before even really going to a supplement. Because really, I mean, we are what we eat, and the same goes for pets.
Mhm. And just I know, just kind of taking that one step further, I know in your line of work now, you sometimes create personalized diet plans for dogs and cats, or just dogs?
For dogs and cats.
Okay.
Yeah.
So what I know, and we'll give you like your information a little bit later on, but when would somebody need a personalized, individualized plan from somebody like you?
I
When
see.
would they come to you? Yeah.
Well, so yeah, and so I mean, I would say come to me immediately just for a generalized how to make home cooked food and not getting it off the internet, you
Okay.
know. So personalized, when I actually more legitimately personalize a diet, that's when I'm going towards the traditional Chinese veterinarian aspect of something
Okay.
that's treating a sort of a pattern out of disharmony. So, for example, something like anxiety, I could say. So anxiety has to do with in Chinese medicine. We're looking at starting off with feeding the spleen, which is considered the stomach correctly. And so if we are feeding the spleen cooked food, it's able to transform that food into gu qi, which is considered the essence of life. And that gu qi helps nourish the other organs. And so when we start to do that and we're looking at things like anxiety, anxiety comes from the liver being overheated in Chinese medicine. And so we want to actually cool down that liver. And so there's certain foods that have certain energetics. So there's like chicken would be a hot energetic, pork would be a cooling energetic, beef is considered a neutral, fish are cool. So feeding more cooling foods to help sort of balance that out. And so that's where it sort of the more personalized diet comes into play for me.
Okay. And where do we learn more about the Chinese diet there that you're referring to?
Come to me. No.
Come to, okay. Okay. We'll come to you.
There's actually a really great book called Four Paws, Five Directions.
For-
That's really helpful. Yeah. And there's lots of information out there,
Yeah.
on it. But Four Paws, Five Directions, which I think I have it back there. Yeah, it's back there. Is really good. It kind of breaks it down a little bit easier because it's when I first started taking that, I was sort of in a world of like, what is this? But again, like especially pertaining to anxiety and allergies, like it really can make a difference for a pet.
Nice. Okay. And now I'm going to ask you a personal, selfish question.
Oh, good. Yeah.
What I've got 2 1-year-old cats, Nico and Milo. What would be your number one nutrition tip that I could apply to them that would help them live a long, healthy life?
What are you feeding them right now?
So right now, I just switched them to Open Farms.
Mhm.
It's human grade. So one of our other experts in this series, she did pretty extensive deep dive into all the cat food served in the U.S. She's based out of the U.K. and that was on her list. So have you heard of Open
Yeah.
Farm?
Oh, yeah.
Okay. So
Yeah.
I do some wet and I still do some dry, but the dry is like freeze dried coated and freeze dried bits, and then uh, uh, what is the I don't know, I forgot what the bone broth coated as well.
Oh, nice.
It
Okay.
seems very very healthy and
Yeah.
ingredient wise, but that's what I feed them a mixture of that hard food and the wet food from Open Farms, and then I even just recently bought their bone broth that I
Mhm.
pour over their food now.
Yeah. I just think rotation, honestly.
Rotation,
Yeah.
okay.
Rotation, rotation, rotation. That you
I have
never.
not done that yet. I've been
Yeah.
doing all chicken
Yeah. Oh
flavor.
gosh. Yeah. Especially. Yeah. So
Mm,
definitely rotating proteins because it's so basically what you're doing is you're going to start from the get-go creating good gut health. And
okay,
so if we're hitting our pets with the same thing over and over again, that's when they're going to start building up an allergy and have inflammation. So
okay,
rotating proteins gives that chance to have the immune system not to like take a break and
yeah,
reset itself. So yeah, that's the only thing I would say.
okay,
I like Open Farms and I mean, home cooking I think is the best because you know
yeah,
what's going in it. But I totally like that's I think Jessica, one of our other coaches, interviewed her too, and she's likes her stuff too. So
yeah.
yeah, so just rotation. Hmm.
Yeah, and I think I'll probably try home cooking at some point, because yeah, I think this is fun for me to learn this now. Again, compared to where I was feeding my other cats, 15, 20 years ago, this feels good. It feels like, hey, I'm actually doing right by them.
Yeah.
Okay. We've talked a little bit about veterinarians, and I love. So I've moved to Mia lived in 3 different cities, so I had a few different vets.
Yeah.
My vet here in Tennessee, I loved how loving she was to Mia.
Hmm.
And like you said, vets love pets and animals. That's why they got into it.
Oh
How
yeah.
can you how can you guide as a holistic pet health coach? How can you guide pet parents to balance kind of conventional vet care? They may love their vet with holistic approaches for their senior cats.
Carefully.
Yeah.
Well, there's so many more integrative vets out there now,
Yeah.
especially in big cities. So I always say find an integrative vet that's going to understand both.
Okay.
Or, I mean, and so that's a great thing about what I do as a holistic pet health coach is that we sort of are that other holistic side to it. And
Mhm.
so it you're gonna vets it always depends on the vet.
Yeah. 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 Right.
Most vets have been, I will say, and I'm not one of these that I'm like vets are, I'm pro vets. Like, again, like I've worked with them, like I've seen them. I've seen bad vets too, but most of the time, most of it I've seen good vets. But I would always say that if you have a vet that tends to be a little about it, that
Mhm.
means that they don't really understand it.
Right.
And so that's where I would say you may want to find more an integrated vet. Um,
Mhm.
but most vets, I will say, are pretty open to um, supplements. Um, but you just have to. The thing is that and this is why a pet health coach is good. You have to be very educated when you're explaining to your vet why you're using a supplement and why it's and the reasons behind it. So
Mhm.
what I run into a
Uncle
lot.
Daly told me.
I'm
I'm
like,
like, "Oh, okay."
"Oh." The guy that does horror movies? No.
Yeah.
So I always make sure with any like new student I have, if to make sure that they always have backing behind what they're presenting for a vet, because vets are they're brain people. They want backing. They want studies, and so especially with like home cooking, I'll run into a client that says like, oh, my vet totally poo-pooed the home cooking, they think it's crazy, and I'll be like, well, what did you say to them? And they'll say, well, they asked me what I was feeding, and I said I'm cooking food for them. And so any vet is going to be like, oh God, so you have to, like, I always say, like, especially for the crock pet diet, I say, this was invented by a veterinary nutritionist. It's formulated to meet above AFCO standards. It's been used in clinic for over 10 years. That's
Mm,
a big thing.
yeah.
You have to always present that with vets. So that's how you have to kind of handle vets. You got to you can't just say, oh, home cooking, and I give them some turmeric, and
Right. Yeah.
because vets will be like, you're crazy.
Yeah.
So yeah, that's
Okay. Yeah.
that.
I think just open communication really
Oh
just
yeah.
I think that's always the best approach. I think my vet would here very good, just the acupuncture,
Mhm.
because she had recommended it as well. The cold laser treatment, some other things we tried for Mia. So I was really, really comfortable with her.
Yeah.
Um,
Like
cool.
I have a client that it's a dog, but like she there are a couple of supplements I recommended for the dog, and she was she's like, "Oh, I'm gonna bring it up with Dr. Briley first, and see what she says." And like she went to Dr. Briley with some studies she found on some of the supplements, and Dr. Briley was like, "Okay,"
Nice.
because
Yeah.
she has studies. Like, so you kind of have to have a little bit. You can't just go in saying this is,
Mhm. Yeah. The research, yeah, that always helps. Let's wrap up with this. Senior cats, they often need a lot of care, but they also bring so much joy.
Mhm.
What's one thing you think every cat parent should remember as their felines age?
I told you already.
I know. We're kind of bringing it full circle, right? They're the bosses.
I honestly think the number one thing with any senior pet, not even cats, is that you have to just remember you have to look at, and I know like the 7-year age thing isn't really the exact age, but
Mhm.
you can use it as a guide. So like of course my cat Nemo isn't over, he's not 200 and something years old, but I've got a 90-year-old man that I have right now.
Mhm. Yeah.
So what does a 90-year-old guy want to do? Sleep, eat, and poop.
Yeah.
Maybe sometimes in the bed, maybe sometimes out of the box.
Yeah.
So I don't have to panic over, oh my God, he's sleeping so much. Oh my God, this. And I have
Mhm.
to also remember, like, he's going to be still fragile. He's going to, so I think just really just remembering that we are dealing with elderly people and that certain things are going to happen. And you may get to a point too where you freak out because all of a sudden you're going to the vet more than you ever did before. But I can tell you, I took care of my elderly parents and they were going to the doctors every 2 weeks.
Mm.
So it's
Yeah.
just sort of part of life. So I think if people really just kind of equate cats to humans in that elderly years, they'll be able to kind of just take a breath
Mhm.
and
Yeah.
instead of worrying, enjoy the time they have with them.
Yeah, nice. Well
Yeah.
said. And then one other kind of plug for my vet here. You remind me when you said you were taking your parents to see the doctor so often. I had to bring Mia, unplanned visits to my vet. I'd email my vet at night, like, hey, Mia's, this is going on. She'd always be like, bring her in first thing in the morning. So I just really loved that she always squeezed Mia in to see unplanned appointments, which was really nice.
Yeah, and that's, I will say too, you really have to make sure that you have a vet that has that openness to them, because there is something going on in the vet field that has changed, and it kind of has to do with a lot of the corporations buying
Yeah.
vets. So the whole like idea of like bring them on in, we'll work them in. I just seems to be getting less and less. I've heard from clients. So
Yeah.
kind of establishing, I mean, I would, even if not integrated, I would, and if it's an old vet that didn't even care about any supplements, if it's a mom and pop place like that, that's a good vet, even if they're like, because they'll be like, oh, sure, do that stuff,
Right.
but I'll be there to say, oh, I'll meet you there if it's after hours. There
Yeah.
that like whole relationship seems to be dissipating. So to find it is really great. So that's awesome. I love your vet.
Yeah. Michael, before we kind of say goodbye, could you please share your website and then where we can learn more about you on social media accounts, and what you maybe even what you offer on your website for those of us that are virtual to you?
Yeah, absolutely. So so my website is www.positive-wellness.com. And I do canine massage for local. I don't, unless you want to fly me to where then I'll do it first class.
Yeah,
But I do online coaching. So basically, it's coaching where I talk about and educate you on the issue that your pet's having, and then design a personalized diet regarding the issue, offer supplementation and Chinese herbs for your pet. And so you can reach me there. I'm also on Facebook under Positive Wellness Canine Massage or Pet Health Coaching, and then also Positive Wellness on Instagram, and I think TikTok.
TikTok. Yeah.
Yeah.
I'll provide all these links
Thank you.
for everybody. Yes, exactly.
I have the active ones, and I have this one. I can't keep
And I know we had talked before, you were very generous. You said if somebody watching this mentions this interview and is interested in maybe participating in one of your services, you'll take $50 off the consultation fee for that.
So it's normally a $150 consult,
Okay.
and it'll be $50 off. And the consult usually lasts about an hour.
Okay, awesome. Well, thank you very much for that. And then, Michael, just wanted to acknowledge the work you're doing. I love just the approaches that you take, not only with canines, but of course, our senior cats. I learned a lot today. I have a soft spot in my heart for senior cats. I hope these two hellions over here that I now have 1-year-old, I hope they live these long 20-year-old lives like Mia did. And I'm going to implement a lot of what we talked about. So thank you for the work you're doing, but also for making time for being on our summit here.
Absolutely. My pleasure. Seriously, it was really fun. I can talk about cats all day.
Yeah, I love it. Everybody watching, thank you so much for tuning in, and we'll see you next time. Bye, everybody.